Hello, everybody. Right, so right now, when I say start, I want everybody to close their eyes. And do not open them until I say so. Start. You can open your eyes. That was 1 minute. Just would anybody like to share what they felt? Put your hand up or just shout. Seemed longer? Any feeling? Thinking? Yeah. Did anybody wonder why I'd asked you to do that? Did you sort of want to know what was happening next? Well, the reason I asked you to do that is because many patients with rare disease live in that zone all of the time, or they go in and out of it very easily. They're living in the unknown. They do not know what's going to happen next. And that happens over and over again because you don't know what's going to happen next when you get that diagnosis. So I'm not quite sure how this thing works. Where's green for next? My daughter has a rare disease called tuberous sclerosis complex, and she calls these people her ologists, because these are all the people in her life. And many of these she has to see a couple of times a year or once a year. So the people with a rare disease and their families, their lives are surrounded by these people. And that in itself is a burden for families and for the person who has to carry that. But anyway, a lot of these people are really helpful, and it becomes your life, and everybody's dealing with this rare disease together. So as part of a study I did on tuberous sclerosis, and what I should say is that that's not just for TS, that's for so many multi-organ diseases. I'm giving that because it corresponded to my daughter, but there are many other rare diseases who will need the intervention of so many other people. So as part of my study, I interviewed clinicians and I interviewed patients. So what I've now done is randomly selected a number of people in the audience here, and I'm asking the healthcare professionals to read out the quotes from patient interviews, and patient and families to read out some of the quotes that I received from the other side. So there are 2 roaming mics, and I will try and do this as quickly as possible, so you have to be runners, not roaming mics. And can I ask the healthcare professionals just to put up their hands, those who have a piece of paper, and the roaming mic people to come around, and these people will read out quotations from the interviews that I did with 34 patients and families. So there are people here? Yep. They have the mics here. So I'm not going to put them up on the slides. You're just going to hear them from the healthcare professionals who are reading out quotes that I was given from patients and families.
We all carried this, the whole family. Everything revolves around X. It's had a massive impact on us, and we've had to completely change our lives. It's dominating where we can go. It's dominating when and how far we can go on holidays. It's dominating what kind of job we take. And it's dominating a daily schedule, which needs to be relatively strict. We stop going to see our families at Christmas because they can't deal with it.
Okay. Next quote.
Now I'm in the situation. What am I going to do? Where can I find help? You're going private. It's 100 euro per visit. I can't afford this. Okay, you can have 2 or 3 hours, but it needs lots of hours, lots of therapy. And I was thinking, is there any association or organization where they can support, or someone can come and do some therapy? Like, I don't know.
So there you have another parent who has a child who needs so many interventions, and they cannot afford it. And one quote which is not there, and broke my heart here, I'm nearly in tears, she could not afford the bus fare and wandered around town with her child in a pushchair because she could not afford to go home. Next quote.
It's huge. It's a huge burden. Like you have no social life. We don't have a social life together, only when she goes to respite. We have 15 nights where we can go for a meal. And for the rest of 350 days, one of us can go out while the other isn't going out.
So imagine that. I think there are a couple of more. Can you put your hand up so that it makes it, yeah. Yeah, go ahead.
At the public health, they literally would nearly run out of the house when I started to explain. You could see them panicking and leaving. My own GP said, I've never heard of the condition and I can't help you. You know, so you just laugh going, what do you do? Like, you know, when you go to the professionals and they can't help you realistically. So I started studying, and I suppose I never stopped. Like, you know, I've studied. So I educated myself.
And that again is the case of many families. I think there's another one.
When you are diagnosed, you want information. That's what you want.
And there should be one other one. Not there? Okay. So the other one was when somebody took their child, again, to a public, noticed something, took the child to the public health nurse, had a student nurse first who ran out of the room, called the public health nurse who said, I don't know what that is, and go and see your GP. And the GP said, I don't know what that is, go and see your pediatrician. So you've got this constant thing around diagnosis, which we all know about. So that's important. And I would now, on the other side, want to have the patients read out what the healthcare professionals told me in their interviews. So hands up, more mics.
Their priority may be different to what the health professional's priority is. So it's important that you try to work more in partnership, because obviously you can learn from each other. You're living with someone with a condition day in, day out. We don't have that experience.
So there's the acknowledgement from the healthcare professional of the expertise of the family sitting in front of them.
Looking after patients with rare disease, it's completely exhausting. You walk out of those clinics and you are drained from taking on the anxiety of the patient or their family. That's a very tough thing. There's that anxiety all the time and the keeping up. It always feels like you're a little bit on your own trying to figure it out.
I think they become the experts in this very often, don't they? Even if they're not an expert in the actual rare condition, they know that their child better than anybody else.
And there should be another one.
The critical person that is the clinical coordinator, who's offering the specialists who knows the condition backwards, knows the people backwards, and knows the structure of what can happen in a particular area. You know what's available in Limerick, what's available in Donegal, and so on.
Okay, so you can see that everybody's doing the same thing here. Is there one more? No? Oh, yes? Sorry, I didn't realize I had an imbalanced number.
I think anybody who has a chronic condition where you're going to meet people over years, I think there's the opportunities for developing a good partnership relationship. And I think to me, it is the critical thing, I think, in terms of success.
There is no coordinated approach. Care is piecemeal. Patients are not getting optimal person-centered care because each specialist is looking at their particular discipline without communicating with each other.
So I think you've got an idea, but what I'm trying to bring across is that there is this word of and thought of partnership and information. There are certain threads the whole way through. And one thing, I have gone in and out of these hospital appointments with my daughter, and I did not know really the burden that is carried by the clinicians until I did these interviews, because we go in as patients and families and you're there in your professional capacity, all in control, behind your desk, doing your best for us. But I do not know that patients and families really understand the burden that is on ye. So that was troubling to me, and I don't know what we as patients can do to help ye, the healthcare professionals. So I'll be very quick now. There's just one last quote that I will say that kept coming back to me, because this lady said, "They're not assisting us, we are partners in this together." And that was said in many other ways, but that's a short way of putting it. We are partners in this together. And I believe strongly in that. Now, when it comes to clinical trials, that's scary wording. And here's a quote. "My opinion before being welcomed into the world of patient participation," which I should have moved here, was microscopes and white coats. And even though I'm from a healthcare professional background years ago, it was mine too. White coats. And so therefore research, ye as the researchers really need to understand that it can be scary territory, and there's a whole load of education and information that's needed to be given to patients for that, to cope with that. And there is, and I was going to ask Cassie to speak, but this yesterday was one of those workshops where we are working together as patients to work out how to be educated and how to work better with the clinicians. Now this is something completely different. I was in Iran recently. They grow cotton in the north. And here you have cotton, and you have the cotton pickers. This is Halle, and so she's making thread from what you saw growing in the fields. So she's spinning that to turn it into a ball of wool. And I think she's about 90. She doesn't know how old she is. She doesn't have a birth certificate. Here's the wool. And this young girl is called Zara, and she's weaving. Now, she's a beginner, but a more experienced person takes 10 days to make this scarf. Just the weaving part, not the gathering. So I'm thinking, it's the same thing with the clinical trials and the research. Bring it back to ordinary life. Everything takes time. It's very abstract for patients to, and we've spoken about this, to understand how long these things can take. But 10 days, I couldn't believe it. Each little thread going in. So, isolation, that's how people feel. They need information, and families and patients need to be included at every stage. We keep hearing about it. And all of these words have so much happening behind them and underneath them. And of course, we have trust and partnership. So now, last piece of this. Anybody who's here, who's from patient or family side, please stand up. and look around. Now the healthcare professionals, please stand up. No, everybody stay standing. So patients and families, look at all these people who are there working with you. And now how about the industry? And who in heaven's name isn't standing up? What's your role here? The researchers, sorry. You should be up with the healthcare professionals. So really, you're all in this together. You've all got the same aim. And it's just that it is collaborative. Everything is collaborative. So that's me with my scar.